The Minnesota Senate passed a bill today that is going to require the governor to get legislative approval for future peacetime emergencies. Again, that was in the Senate. The House is expected to reject this. The Senate approved the bill 38-29. It requires a majority of both chambers to approve the governor's request for a peacetime emergency in order for it to be extended by another 30 days. The current law only allows the extension unless a majority of both chambers vote to cancel it. But again, House members, which is Democratic-led, are not expected to pass this measure. It just made it through the Senate today. And as we know, the peacetime emergency gives Governor Walz the executive authority to put COVID restrictions into place, decisions that have been met with much controversy, especially over the last few months as businesses have sued the governor for keeping their businesses closed. A new article put out by the Associated Press over the weekend shows that despite contrasting orders by various governors, the toll COVID-19 has had on states nationwide is similar when states loosen restrictions or states that have very strict measures. The toll remains very much the same. And in this article, Dr. Amesh Adalja, a senior scholar at Johns Hopkins Center for Health Security, was interviewed. I'm thrilled to have Dr. Adalja join us to further this conversation. In this article, Dr. Adalja, you brought up an important point. What public health measures actually were the most impactful and which ones had negligible effect or backfired by driving behavior underground as we talk about the restrictions that have been put into place by various states. Do you think some of the restrictions, looking back now, maybe went too far?
I do think when you treat every activity as having equal risk for transmitting this virus, that's probably not the right way to go about it. That we know, for example, that outdoor dining is very low risk compared to other types of activities, that basically anything that can be done outdoors is going to have a lower risk. We also know that each place sort of has its own epidemiology of what's driving infections. And when you look at, that's the value of using contact trace data to be able to say, how are people getting infected in my city, in my town, in my state? And then really trying to come up with measures that help those venues where transmission is occurring operate in a safer manner. And we take this from a lot of what we do with HIV, sexually transmitted infections, or opioid use disorder, where we use a concept called harm reduction, where we know people are going to be taking some level of risk. And the goal is to really give people the ability to make risk calculations, knowing that an abstinence-only approach is not going to really be helpful because people are going to take risks whether you like it or not. So it's much better for public health to actually try to meet people where they are and give them a way to think about different risks and give them a toolkit that they can draw upon. People cannot go and meet people for outdoor dining at a sidewalk cafe. They may then meet people in their house where there's going to be less mask wearing, less social distancing, and it's going to be indoors. So you have to really look at all of those measures and think not only about what the direct effect is, but the cascading impact, what's not seen, and think long-term about, is this a sustainable approach?
We know that the states in this article were extremely different in how they went about with the restrictions. So Florida was used as an example of things being much more loosened, and then in California, extremely tight restrictive measures. It has affected businesses, it has affected mental health. Looking back, hindsight, as we know, is always 20/20. So we can talk about moving forward, but I do want to talk a little bit about some of these businesses who have lost their livelihoods because they have gone by what public health experts have continued to tell them. Our governor continues to say that it is at the advisement of public health officials why our restrictions here in Minnesota have been so tight. What would your guidance be?
My guidance would be to move away from blanket public health orders and use targeted public health by looking at case data. How are people getting infected? And then trying to make those areas safer for people. And you kind of do it with the lightest touch, trying to be as voluntary as possible. That's the way we've seen success in other realms. But many states did not invest in enough contact tracers to be able to do that kind of case investigation. So they were left with very blunt blanket tools. And many states didn't invest in testing, so they have no way of knowing who is infected and who is not. So they kind of fall towards these blanket restrictions, where I think it's much better to actually figure out how people are getting infected and then have guidance reflective of of the actual risk of certain activities. This virus isn't going anywhere, that this has established itself in the human population. So what's needed is a sustainable approach to COVID-19, not one that goes through cycles where everything is open, then everything is closed, everything is open, everything is closed. That's disruptive and not sustainable. But many politicians look at short-range solutions and don't think long-term. And they also don't think about the cascading impacts of what sometimes shutdowns do.
Before I let you go, does this then make public health officials, the governor, others who have been advising governors to keep things closed, because it's become so political, does this make them negligible in your opinion?
I think what we have to come up with is a sustainable approach where you're not trading one thing, you're not trading the short term for the long term, especially now when we have a vaccine in hand, because eventually what we're going to see is this virus is going to become tamed by the vaccine. So what I encourage governors to do is to really look at hospital capacity. That should be your gauge for what your state is doing. And as we vaccinate more vulnerable populations, you're going to see hospitalizations fall. And this has to be then the impetus to develop a sustainable system to be able to manage these cases and kind of move out of this false alternative where things are basically like Mardi Gras every day, or they're like Wuhan, China. There has to be a sustainable middle way where you've built up public health infrastructure so you can test, trace, isolate, and vaccinate, keep your hospitals afloat while allowing as much business to go on as possible. And some of that will include having very strict guidance on masks for a foreseeable period of time, accelerating vaccine rollout, and really keeping an eye on hospital capacity on a day-to-day basis until enough of the vulnerable populations are vaccinated.
Dr. Amesh Adalja, I know how incredibly busy you are. I can't thank you enough for taking the time to talk to me today.
Thank you for having me.
Thank you.